Go.
Okay, this is Buddy. Buddy's a young cat who came in not too long ago to be neutered today. And when they first brought him in, he was very sweet, loving, but he quickly became fearful because we tried to get a blood sample from him. He didn't understand what we were doing, and he became defensive. And so we held off on getting his lab sample because we wanted to just go ahead and sedate him so that we could neuter him with as little stress as possible. He really started to get worked up. So we've had him in the cage here for the better part of 40 minutes or so. I came in a few minutes ago to check on him, and he was up at the front of the cage and immediately started hissing at me. But he allowed me to put my hand in the cage. He didn't swat, didn't lunge, and actually allowed me to pet him a little bit. Continued to growl and hiss the whole time, but he's not an aggressive cat, and I could tell just by his allowing me to do those things. So now we're back in here about 15 minutes later, and again, I don't know that you can see him in the back of the cage there. He's a little gray and white kitty with a white muzzle there. Can you see him?
Yes.
So his pupils are not real dilated, but they certainly are somewhat dilated. His ears are upright, they're not squat. Usually when a cat's going to be very aggressive or extremely agitated, those ears will get pinned down either forward or back, so his ears are upright. His whiskers are not forward, they're in a normal position, and he's not really staring me down. He's kind of looking away. You can tell he's fearful, but he's not confrontational, which cats tend not to be confrontational. That's their last mode of that's the last decision that they make if they feel cornered. They'd rather run away from a fight than fight. So he's certainly not showing any signs of aggression, but he's a little nervous. So what I'm going to try to do is just kind of try to gain a little bit of his confidence. You can see he's still kind of looking away. He doesn't want to make eye contact. He's hoping I'll just go away. So we know he's a nice cat, but he's fearful. So we're just going to go slow with him. Hi, buddy. Hi. Hi. He's growling, but he's not pulling back from me. He didn't give me that mock lunge, or he's not swatting at me either. He may do that if I try to grab him, and I'm not going to do that right away anyway. But you can see he's sniffing me. Hi, baby. I know, buddy. It's okay. He does allow me to kind of pet his chin a little bit. Not thrilled with it, but and I think, you know, a lot of people would be intimidated by this, and I'm not. He's trying to hide his head in the corner. It's all right, buddy. What we're attempting to do is get him out of the cage so that we can give him his anesthetic injection for his neutering. So he already has a blanket in there. I think what we're going to do is, he swatted at me. I'm going to just try to cover his face so that sometimes getting rid of that visual stimulation will help. Do we have his injection ready?
No.
Well, why don't we get that? So while we're waiting, we're just going to kind of hold him here. He's not struggling at all, and I'm not restraining him at all. He's facing the other direction. I have my hands on his shoulders. You can probably hear him growling, but I've got his face covered. He doesn't see me, so the threat is diminished by that. So I'm just going to cover him up and really just get him in like a kitty burrito and get him in a position where we can see the muscles of his hind end so we can give him his shot. So Autumn's going to go ahead and give him his sedative. He's not going to like it. If you give it slow, it helps too. Okay. So we were able to give him a shot. Minor injuries, but he's not a bad cat. I'd say that he's probably a level 1 under most circumstances, but when he's here and stressed, he can turn into a level 2+. You know, those are fine line gradations, but he wasn't difficult to get out of the cage. Once you can read body language and see what he was telling you, and some of the gestures that I mentioned kind of indicate that he wasn't aggressive, but more fearful, and he was just letting me know that. And so I think confidence is the key, moving slowly, no quick movements, and most of the time you're able to cover them, get them out of the carrier with minimal stress to you and to the animal. And now that he's had a sedation, he should be fine. So hopefully that was a good lesson. Bye.